Well, September is Prostate Cancer Awareness Month. So today we're talking about one of the most important and common cancers among American men. It's estimated that this year, more than 268,000 men will find themselves facing a prostate cancer diagnosis.
Despite being responsible for tens of thousands of deaths each year, the prognosis can be a good one if it's caught early. I spoke with Zero's president and CEO Jamie Biersey, along with prostate cancer survivor Tony Minter, about their message for other men.
As we work to spread awareness, what are we seeing right now with current trends with the disease?
Absolutely, great question, especially coming out of the pandemic for the last couple of years. But first, let me start overall that there are 3 million American men who are living with prostate cancer right now, and a man dies from the disease every 18 minutes. But there is hope through early detection, and early detection saves lives, meaning that the 5-year survival rate is 99% when prostate cancer is caught early. However, that falls to just over 30% or 31% when prostate cancer is caught in the late stages. And you mentioned the trend coming out of the pandemic. There have been studies that have shown that 77% of cancer patients experience delays or disruptions of some kind during the pandemic. And others have shown a substantial decline in cancer screening rates during the pandemic. So, if you've skipped out on, some of your health screenings, prostate cancer testing being one of them, September, which is Prostate Cancer Awareness Month, is a great time to make that resolution to get back into staying on top of your health screenings and get tested for prostate cancer.
Yeah, so important. As you mentioned, one of those things that's not necessarily unique to prostate cancer, but certainly noteworthy is that importance of early detection and how big of a game changer that can be for someone's prognosis. Are you worried that we're going to be seeing more cases now of more advanced cancers because people have put off those screenings for a few years?
That is a concern, yeah, and because I don't know, just as a guy. And I know it doesn't go for every man, but for myself, and I've been involved in this cause for 20 years and talked to a lot of men who are either at risk or a lot of men who are patients. It comes down to, any excuse is a good excuse not to go see the doctor for us guys. So if you, throw a pandemic in our way, if you say that, oh, you don't have any symptoms, right? You don't need to get tested for prostate cancer, you'll be fine. When in fact, it's a really simple test, and prostate cancer doesn't have any symptoms in its early stage. You can feel completely fine. It's not until you get to advanced prostate cancer where you start experiencing some of those symptoms. So it's important to get in front of that.
Well, Tony, I want to ask you about your experience as a cancer survivor. Tell us a little bit about when you were first diagnosed and your experience with prostate cancer.
Sure. I was diagnosed in 2012. I had been going through screenings since age 40. I was 52 when I was finally diagnosed. And one of the things that the doctor said, she says, I got good news and bad news. The bad news is you have cancer. The good news is we may have caught it early. When I was in the military, I was a flight medic, so I was in the medical field, and I understood a lot about health. And so I knew that early detection was important. So when she said you caught it early, I knew that my chances of survival were very, very good. Mm-hmm. She also told me to take some time and do some research to discover what it was that I wanted to do about my prostate cancer diagnosis. At that time, there was a limit on what you could do about it. It was either radiation or surgery. And so I decided that I wanted to do something that would take care of the prostate cancer and not be so concerned about the side effects. My prostate journey started in 2012 and it still continues this day because of side effects and things like that. But the cancer itself is at bay, and that's due to early detection.
What would you say to someone out there who has not been to a screening yet, maybe is at that age where they got to start looking at it or should have been to a screening or two? What's your advice for guys out there to take that first step?
So my advice is, first of all, to try to educate them. But the advice that I would give them is that prostate cancer is treatable when you catch it early. It's treatable. The journey gets much, much more difficult the longer it goes undetected.
Mm-hmm.
You start to feel signs and symptoms. That's not a good thing, because the treatments become more difficult, become more challenging, and the side effects become much, much more serious.
Mm-hmm.
So if you know what the risk factors are and you fall into those categories, African-American male, veteran, family history, lifestyles, and things like that, go and get checked out. Don't wait until you have pain. Don't wait till you have difficulty urinating.
Mm-hmm.
This is something that can be taken care of if you catch it early.
Okay, so where do you start? If you want to learn more about risk factors, Tony mentioned several of them, those screening guidelines, and what to do if you are diagnosed with prostate cancer, there's a lot of resources at zerocancer.org. It really is one of those conversations for the women out there. Have those conversations with the men in your life. For the men out there, those screenings really do save lives.
Yes, it's very important. Time now.